Hi, my name is Daniel. I'm the new Hematology Research Fellow at the Sir Charles Gardner Hospital in the Linear Clinical Trials Center. And we work closely with the WA Blood Cancer Research. I was born and grew up in Malaysia, came over to Tasmania to study medicine. And since then has continued working in medicine over the last decade. I started early physician training, not knowing what I wanted to do. Like many of my other peers, there was often a worry or reluctance to do hematology among my peers because of its complexity and the connotation that it has working with patients with complex hematological malignancies. But I take that as a challenge and as a sort of and over time I enjoy the field of hematology, the complexity that comes with it, and more importantly the professional therapeutic relationships that we get to build with our patients over time, with the therapeutic options available in hematology. It's more frequent than not we see good outcomes and from my working experience. And so I finished my training in hematology recently, and the Linear Clinical Research Group and Sir Charles Gardner took my attention because it boasts one of the biggest trial repertoire in the country, and I wanted to know more ways to help my patients, and hence clinical trials quite attractive to learn more. I want to be the best version of myself. I want to be a clinician researcher, and I want to delve into research as best as I can. And my ultimate goal is, of course, to provide excellent patient care, but also to be able to be in a position where I can offer a wide range of therapeutic options to my patient, including clinical trials, and understanding the inner workings of clinical trials, the decisions and the options, the logistics behind clinical trials is very important for me to gain in the next couple of years. Ultimately, I would like to be, I would like to participate in an investigator-initiated trial and be at the forefront of clinical trials and research in Australia. My particular area of interest is lymphoma, particularly aggressive lymphoma, but I do work across both lymphoma and leukemia care. And some of the notable achievements that over the last in my early my career, I'm particularly interested in research and teaching, and over the last years as a hematology trainee, I've set up various teaching programs for medical scientists, for students and nursing staff at my local hospitals, participated, created a sort of cancer education program, and hematopathology programs for medical scientists, as well as be involved with medical students. In the end, I do want to continue to participate in teaching and educating emerging practitioners. Teaching remains at the heart of my interests, and I do want to participate in medical education, be it with in a clinical role within the hospital or within medical schools, and in terms of clinical trials and research, my clinical experience has been very has been quite integral in my training, and I think I can bring this to the group. I want to learn the breadth of lymphoma and leukemia research and clinical trials that's on offer at the Sir Charles Gardner Hospital, but also at the Linear Clinical Trials, and across aggressive and indolent lymphomas, T-cell lymphomas, myeloma, and acute leukemia. I want to be able to be at the forefront of the trial repertoire that's available for us, because at the end of the day, these are findings that will end up coming to our day-to-day practice and will inform our day-to-day practice, and knowing them at this early start and understanding these therapeutic options is quite integral in my future clinical career development. I'm hoping that that we in medical field, and certainly in hematology, we're constantly looking for ways to improve ourselves and improve our ability to care for patients and improve their quality of life. And while clinical trials are a central aspect to improvements, I always remind myself that at the center of all these is truly patient care, and hopefully I want to try and inculcate quality of life and knowing what my patients do in my day-to-day practice, even in my clinical trial assessment. Just knowing them, knowing who they are outside of these four walls and outside in the home, and whether what we've done has actually improved their life and their quality of life. And that's key to me. Thank you.